Relationship I made while I was there, I was with a little boy named Alejandro. He was actually the first person that I talked to when I got there. And I was really nervous because I was the youngest one on the trip and I had no idea how to be a dental assistant or how we were going to work on the patio of a schoolyard. And so he came up to me and he asked me to see my teeth and he told me to smile for him. And I was embarrassed, but I was happy, and he really just changed the trip for me because I was more confident. And while we were in Honduras, we went to the villages for 4 days. And over those 4 days, 6 dentists pulled over 1,200 teeth. No pensamos así aquí, which means we don't think like that here. I first heard this from a 27-year-old Honduran woman who came to us as a patient in the hopes of having all of her teeth extracted. She only really needed 2 taken out, but she wanted all the healthy ones taken out too because she was afraid that in the future they would cause her pain. She didn't want to brush her teeth or change her daily habits. She just wanted to have them all removed. We tried to explain to her that keeping her teeth was really important, that they were very valuable, but she said, no pensamos así aquí. One thing I really noticed about Alejandro was that he was proud of his teeth and he brushed 3 times a day and he told us proudly that he did that. And he wanted to know how to prevent cavities and he had little brothers and sisters and parents that didn't know how to brush correctly. And I really think that a video like this could show him how to teach his family and that he was willing to listen and that there are other people that are willing to listen. And this video could help them teach each other.
I would like you to meet my stepbrother Logan. He is 12 years old and has what looks to be a healthy smile, but looks can be very deceiving. Here I am pointing out with the probe the areas you will usually see plaque, but even in this close-up, you can't see any. Here you can see we have painted a disclosing solution on Logan's teeth. This makes the bacterial plaque very apparent. I'm putting retractors on Logan's lips so we can better see where he has been missing with his brushing. One of the problems with plaque is not only that it is the same color as our teeth, but it also hides behind our lips. The dark pink on Logan's teeth is the disclosing solution, which has stained selectively the bacterial plaque left on his teeth. I would like to remind you a minute ago, when we looked at his teeth, we did not see any plaque. Logan believes he is doing a great job and brushes twice a day. However, he is completely unaware of all the plaque he has been missing. This is the plaque that causes gum disease and tooth decay. It is a universal problem for many people, and Logan is not an exception. Now I am going to demonstrate proper brushing technique. You want to push the bristles firmly against the tooth at an angle right up against the gum line. You also want to use small, tight circular motions when you are brushing. As you can see, plaque can be very difficult to remove. It requires more pressure than some may think. Very often, when plaque that has been left on the teeth is removed, the gums will bleed, and that is a sign of gingivitis. Now I'm just brushing using those small circular motions to remove the rest of the plaque. And I'm pushing the bristles in between the teeth. I'm pointing out now where there are spots that are bleeding from the removed plaque, which means that Logan has some gingivitis. Gingivitis can be reversed in a few days with proper brushing, but unfortunately, cavities require further care. For the people in Honduras, the process went on for so long that the problems were all irreversible, and the only way to help them was to extract all of the infected teeth.
This is what has inspired me to make this video and to do this project. I really hope that this video can serve as a template to make another one when I return to Honduras. And I want to use some of the locals in the video and coach them on how to teach each other how to brush their teeth. I think it'll be a lot more effective because they'll be able to relate to each other.